Hi, I'm Dr. David Hill, and today we're going to talk about how to treat side effects from flu mist in your children. So what is flu mist? Well, it is a brand name for a type of influenza vaccine, specifically the live attenuated influenza vaccine, or LAIV, to people who like to use things like LAIV when they talk. What does it do? Well, flu mist is actually a weakened form of the influenza virus. If you go get a flu shot, you're not getting the influenza virus at all. You're getting proteins that are shaped like the influenza virus, tiny fragments that allow your immune system to create a vigorous immune response to influenza virus. So when you get the live attenuated influenza vaccine, the flu mist, you're actually getting a very weakened form of the influenza virus, and it may cause a very weak influenza infection. Now, this isn't a dangerous influenza infection that could land you in the hospital or even kill you the way a real flu, a wild-type flu can. And please remember that the real flu, the wild-type flu, kills 30,000 Americans in an average year and hospitalizes 200,000. So if you're on the fence about whether to get the vaccine or not, for gosh sake, please, please, please get the vaccine. It is one way to save your life. So we're talking about the infection. Well, you may feel a little achy. You may get a little runny nose. You may get a little sore throat. You may get a really mild cough or headache. None of these symptoms should be terribly severe, but they may occur. So what are you going to do? Well, you do the things that you always do. A little acetaminophen, which is Tylenol, or ibuprofen, which is what's in Motrin and Advil. A little bit of warm fluid, get some rest, and you should be feeling better very soon. Remember, this isn't a full-blown influenza infection, and it tends to pass quite quickly within a few days. If, on the other hand, it's not going away or getting worse, it's possible that you caught the flu on your way to getting the flu vaccine. So you might want to talk to your doctor, especially if you end up with a high fever over 104 degrees, bad muscle aches, severe vomiting and diarrhea, chest pain, or difficulty breathing. Those are all concerning signs, and those are not from the vaccine in all likelihood. They're from a real infection. So be sure and talk to your doctor about that. Talking about how to treat the side effects of the flu mist live attenuated influenza vaccine, I'm Dr. David Hill.